Okay, a good afternoon to you all. I'm here to present to you my study. This is actually part one of the study that I'm working on, applications of 4IR on the diagnosis and management of STIs among key populations in sub-Saharan Africa. And maybe a disclaimer as I start. Initially, this study is actually focused on key populations, and I'm talking about key populations in the areas of HIV and STIs. So I'm talking about men who have sex with men, I'm talking about transgender people, I'm talking about gays, I'm talking about people who are incarcerated, I'm talking about sex workers. So you would see that when I started, actually, this is a study which is a sub-study of an umbrella study which we are conducting in our research center, which is focused on HIV responses amongst key populations. And you will see that when we are talking about key populations, we are talking about those people who are discriminated, those people who are not so welcome, especially in our society. We are talking about those people who are also our brothers, our sisters, our husbands, our fathers, our uncles. They are people we live with. They are people who are amongst us. And these people, they are so much affected by HIV and STIs. And the unfortunate thing is that because of structural issues, these people, they cannot go freely to public health facilities to seek treatment. Hence, at the end of the day, they continue to spread STIs, including HIV. So the presentation I'm going to talk to you this afternoon about is based on that outline. Okay, so why diagnosis and management of STIs? From World Health Organization 2021 and 2023, it has been established that every year, more than 2.3 million people are dying because of STIs and HIV. And when we talk about why sub-Saharan Africa, it's because sub-Saharan Africa, we are carrying the highest burden of STIs, the highest burden of HIV. And carrying it home here in South Africa is actually the core of HIV and STI worldwide. So it's very, very important for us to look at this issue. And when we are talking about data, it's important also, like I've said before, when we talk about key populations, these are people whom we kind of segregate and they shy away from actually identifying themselves in the community. And at the end of the day, they are disadvantaged when it comes to accessing health facilities and health services. Okay, so this study actually aims to address the gap in knowledge on implementation of 4IR. And also, let me say that I'm saying 4IR, that was the initial dream and vision, but upon conducting the systematic review, at the end of this presentation, I'm going to tell you what actually happened. So yes, I was looking at across the board when we talk about 4IR, talking about Internet of Things, talking about nanotechnology, many things that fall under 4IR, but the findings were different. Okay, so this was a systematic review. It's registered under Prospero, and the systematic review was actually conducted from last year, August 2023, and it was finalized this year in May 2024. And this systematic review was conducted based on primary studies. The major focus was to look at primary studies which were dealing with key populations. Unfortunately, there were not so many publications on key populations in sub-Saharan Africa, so I ended up including general populations. So that's why the topic I said, it kind of changed. And then I was looking at the systematic review, and then all the procedures were followed, and this systematic review was conducted, guided by Covidence, which is a platform for conducting systematic reviews. Okay, the search strategy. This study was conducted by 3 people, and everyone was doing their independent research. We would come together on a round table, we would talk about it, and deal with any conflicting issues and then settle them down. And then, of course, yes, there were online searches which were done talking about databases, online databases, and also manual searches were done also online, looking at any other sources of information, grey literature, information from websites, for example, talking about United Nations websites, talking about CDC websites, and even UN websites. Okay, so eligibility criteria, it was actually guided by the PICO framework, where we're looking at the issues of population, intervention, comparison, and the outcome. So everything had to speak to 4IR approaches, and anything related to 4IR. So study selection, after going through the different online databases that were selected, where we got information, all the identified articles, publications, information, they were actually saved in different folders according to their sources, and they were then exported to Zotero, where I also exported them from Zotero to Covidence, where screening continues, starting from the topic, talking about the abstract, and then the availability of the full text. Okay, so all the studies that were reviewed in this research or in this systematic review, they were actually checked for quality assessment to see how best the people who did the studies followed different procedures which warranted their studies to be quality studies. Okay, so that is my Prisma diagram, which was established, or it was made for me automatically by Covidence, and I'm sure you can see there I started with 1,443 articles at the beginning, and you would see that looking at these, they were talking about different 4IR approaches, but remember my focus is on sub-Saharan Africa. So a lot of studies had to fall away. Why? Because they were not supporting the criterion that was guiding this study. They were not supporting even the population, talking about the issues of the outcome and even intervention. So at the end of the day, the systematic review was finalized working with 20 articles or publications. Those were some of the study characteristics that I looked at, the authors, the year of publication, study period, and even the study design is not here. There are several many other characteristics which are not here, which I also looked at, even looking at the research outcomes, looking at the impact of the research. Okay, so like I said, initially this study was focused on key populations, but because of lack of studies, I ended up also employing the general population. And talking about the general population, you see general population was actually making the majority of the study, and we just have a very small portion of key populations, and some were based on complications due to STIs. Okay, so coming to the findings were very interesting. I looked at the 4 regions of sub-Saharan Africa and Central Africa. Actually, what I can say at this point is that all the 20 studies were secondary. They were conducted based on secondary data. So it's as good as secondary studies were done, because these were studies where they took secondary data, they analyzed it using machine learning algorithms, using AI algorithms and models, and then they made conclusions. So not really a primary study was conducted direct in a health facility whereby information was collected in real time and analyzed. These were all secondary searches that were done. And you'd see that Central Africa had only Cameroon featuring in the studies. Talking about West Africa, it had 3 studies, and there were about 6 countries. And then East Africa, countries from East Africa, they were featuring actually in about 10 studies, and there were 5 countries there. And Southern Africa, where we are, had the highest number of studies conducted, and South Africa and Zimbabwe were leading with 5, appearing in 5 studies each. So you would see that when you talk about the issues of proportion, when you look at the bar chart, you can see that even what is happening, how even the studies are being done, is not proportional, except when we talk about Southern Africa and East Africa. But otherwise, when you look at West Africa and Central Africa, especially Central Africa, is least represented. And we are talking about 4IR, and we are talking about accelerated impact. And the question I may ask at this point is, where are we as Africans? And we want the accelerated impact. Okay, so talking about the uses of the approaches that were found, you can see that several machine learning algorithms were actually being used, random forest, XBoost, and most of them, they were used for prediction. Most of them, they were used for prediction, and also they were used for identification of people at risk of acquiring HIV. They were used for HIV testing, HIV STI detection, and also, let me say at this point, most of the studies, actually 19 out of 20, they were on HIV. Only one was looking at STIs. So you'd see that most of the things they were talking to HIV more than STIs. And different approaches, different technologies were actually used for the sake of identifying those who may miss their hospital visit, those who may miss different issues which are related to them getting their medication, their test, or their treatment. And when you look at this study, I said diagnosis and management of STIs. Why? Because when you're talking about STIs, we have got those which are curable and the others which are non-curable. Successes and barriers, I'm sure when we are talking about AI, machine learning, now from the analysis, the findings actually establish that I cannot continue saying for IR. Why? Because mostly artificial intelligence was prominent, it was dominating, and most of the studies, they used machine learning algorithms, machine learning models, artificial intelligence algorithms, of which we know machine learning is actually a subset of artificial intelligence. So it was used for improving STI detection, which is our major problem, why we are struggling in sub-Saharan Africa to deal with STIs and HIV. Why? Because in most of our hospitals, in our health facilities, we are still using syndromic management, where a health practitioner just looks at you, asks you questions, and they will tell you that because of 1, 2, 3 that you have told me, it means that you have this or you don't have this. So it is actually bound to a lot of human error, and at the end of the day, you'd see that there are a lot of mistakes. So machine learning, artificial intelligence has actually come as a better option for us when we talk about diagnosis and management of STIs, classification of images for people who do self-testing using AI and machine learning technologies. They can actually help to actually interpret the images, and you can actually talk about one being positive, one having the symptoms, or one having a certain STI, and accuracy has been found to be much better. Unfortunately, there are barriers when we talk about issues of machine learning and artificial intelligence, or 4IR technologies in management and diagnosis of STIs. The major one was lack of access of high quality data, and that's the reason why I'm here. DIRISA have said they've got facilities for us to store our data, but the question is, do they have the kind of the data that we are looking for? And I'm also even appealing to everyone in the house, anyone who can come forward to collaborate with data, please, you are welcome. We are looking for data, sub-Saharan Africa, even outside sub-Saharan Africa, so that we can even see and do some benchmarking. There's no data. As I came to this conference, I received one set of data from another private organization here in South Africa. But when you looked at the data, it's so incomplete, it has a lot of missings, it has a lot of errors, and I have to do a lot of cleaning to that data. And at the end of the day, you also want to question the quality of the analysis and the quality of the findings that are going to come out there. And also the other barrier is lack of standardized collection procedures leading to inconsistency in model performance. So you would see that the quality of data will determine the kind of modeling that you are also going to do. Also the issue of high costs, advanced technologies and infrastructure. We don't have infrastructure. We are talking about HPC, we are talking about all these technologies that we are talking about, but do we have them? We have students in the universities, we are teaching them about technology. They know it in theory, but can they practice? Can they use them? Do they have access? And talking about the issues of expertise, we also don't have expertise. So those are some of the barriers which are actually limiting the use of technology in the medical field, talking about diagnosis and management of STIs. And of course, from the results, the major issue is that when we talk about us here in sub-Saharan Africa, we don't have a lot of things, and hence the diagnosis and management is not adequately done, and we need machine learning, we need 4IR to help us to come up with proper diagnosis, which is correct, accurate, and efficient. And like I said, syndromic management is actually killing us. So in brief, what is it? From this, we are going to, these are the other studies that I am conducting, and some data analysis, like I've said, is already started, and there are issues talking about even how authors are collaborating here in sub-Saharan Africa, talking about the different associations that are there, and anyone with any leads to key populations, I'll be happy. At the end of the day, what we want to do is to do a spatial analysis to be able to allocate and say, people in this province or people in this region of sub-Saharan Africa, they are hard hit, and what is it that can be done to help this situation? So we want to go to the granular details of the situation and offer as much help as possible. I thank you.
Yes, thank you very much for the presentation, and I have this to end off. Okay, guys.